Things we do in the hospital that may not always make sense to patients. Patients often ask, how come I'm not getting the medication I take at home? Now, granted, sometimes it's an error. Sometimes they don't realize what you're taking at home, or they know what you're taking, but they just don't order it. However, sometimes patients cannot take what they usually take at home because, for example, they're not allowed to eat. Let's say you are NPO, which is another video that I made. If you're not allowed to eat anything, then you may not be able to take any of your oral medications. Also, there may be some concern that the symptoms that led you to be in the hospital may be caused by one of your medications. Or it may be that your medications may interfere with some of the treatment that you need to get. If you have any kidney dysfunction or liver dysfunction, there are certain medications that you can't take until that is taken care of. But sometimes it is simply because the hospital pharmacy doesn't have it. Because the hospital pharmacy is relatively small, they will often just have one of a particular class of medication. So let's say a statin, a cholesterol medication. They might only have one or two of the statins. They're not going to have all, I don't even know how many there are now, 6 or 7. So if you are taking one at home and they don't have it on formula, then they might switch you while you're in the hospital. And then when you go home, you should be able to resume what you normally take. So if you're in the hospital and you're not getting the medications you usually take, please speak to the physicians taking care of you while you're there and ask them why you're not on it. Again, it may have just been an omission, but there may be legitimate medical reasons why you can't be on it while you're in the hospital.